everyone! My name is Louise GARCIA. I am a physical therapist and a faculty from the College of Rehabilitation Sciences. So for this video, I'm going to show you the different physical therapy assessment tools that we use during our examination. But before that, let me just share with you one of the rules of physical therapy is to conduct examination or assessment. Now, when we do this, it is divided into two parts. The first part is the subjective examination wherein we conduct history taking or interview with our patient and we ask specific questions that are related to their condition or to their injury. And then we also ask any family history or any personal, social, environmental history or past medical history. So the patient will be asked different questions by the physical therapist so that we could arrive to the pattern of what happened to the patient. Now, for the objective examination, this is where we conduct different tests and measures, no? So that we can identify the extent of the injury or the problem of the patient and identify specific signs or symptoms that is presented by the patient that might contribute to their condition. And also, this examination is important for us because it could help the physical therapist formulate a diagnosis and of course create a specific plan of care that is fit for the need of the patient. What are the different physical therapy assessment tools that we use? Alright, so of course, first up is our vital assessment tools. Okay, so this is a stethoscope, and then we have the BP apparatus or the sphygmomanometer, and then we also have a watch here, so for taking pulse rate and respiratory rate. And then I also have here a digital thermometer, so if in case you need to get the temperature of the patient. And what I also have here is the pulse oximeter, alright? So to get the oxygen saturation of the patient. So, of course, for any allied health profession, it is important for us to assess the vital signs so that we will know that the patient is stable before we conduct our, for example, our treatment or our assessment and other activities that we want them to do, alright? Now, specifically for physical therapists, what I have here is called the goniometer, alright? So, if you could see here. Right, so goniometer it's like a ruler with a protractor in one. So, where do we use the goniometer? So, we use the goniometer to measure the range of motion of our patients. So, what do we mean by range of motion? So, we all know that our joints have different degrees of mobility. So, let's say, for my shoulder, I can move it upward. So, we use the goniometer to measure if the range of motion of a patient is in normal or if there is limitation of motion, because once there is limitation of motion, and therefore we have to address that limitation of motion, either providing exercises or providing modalities that would help increase their range of motion. So, as for example, this is a large goniometer. We use this for larger joints of the body. So, for example, in our wrist, elbow, shoulder, hip, neck, etc. And then, we also have a smaller version here. So, this one is a smaller version. So, we use it on smaller joints of the body. So, specifically the fingers, alright? So, we also measure the range of motion of the fingers, right? We have is the tape measure, okay? So, this is just a regular tape measure. Now, the question is, where do we use the tape measure? So, we use it to assess the limb girth of a patient or the muscle bulk of the patient. Now, when do this happen? It depends on the injury or the problem or the condition of the patient. So limb girth measurement is usually done if the patient has increased fluid accumulation in the body. So it's sometimes noticeable on the distal aspects of the fingers and of the feet. Okay? Now, when it comes to muscle bulk measurement, it depends naman on the use of the muscles of the person. So if a person is most likely bedridden and they don't use their body or their muscles, so they lose its size. So we have to measure it because it might be a sign of an atrophy. And of course, atrophy should be addressed through providing exercises. Now, on the other hand, for performance athletes, for example, or healthy patients or healthy individuals that want to improve their body physique, we also use the muscle bulk measurement to measure, of course, their muscles if there are improvement, or if, for example, the size of its muscle, their muscles have already increased. Okay? So, tape measure. Now, the next tool that I have here, or tools basically, are these three. Okay? So, if you could see, this is a NEUROHAMMER, or we also call this the REFLEX hammer. And then I have here the tuning fork. And then I have here the pen light. Okay, so I have here the pen light. So these three tools are used for neuro assessment. Okay, so specifically for neurological cases. So for observation, so of course, if you want to be specific in observing, specifically for cranial nerve assessment, we use the pen light. So we point it into the eyes or into the mouth to see the structures if they're symmetrical or not, no? And then tuning fork is also used for cranial nerve assessment, and sometimes it happens also that it can be for bone assessment, but most of the times it's used for cranial nerve assessment. Now, for the reflex hammer, or we also call this the NEUROHAMMER, so we use this for assessing the reflex of the patient. So that's why it's called reflex hammer. But inside it, when you twist the reflex hammer, you can actually get a pin and a brush. Okay, so this is a pointed structure, and then this is a soft structure. So this one, we also use this for sensory assessment. So for patients who have impaired sensation, for example, they had a stroke or they had a spinal cord injury and their nerves were also affected. So we have to confirm if they have impaired sensation through these two devices. Alright? So those are just some of the physical therapy tools that we use for examination. But of course, if we don't have the tools, the best tool that we use is our senses. And the most useful sense for us is our sense of vision. Okay? So it is very important for physical therapists to really be observant of the different presentation of the patient or clinical manifestation, because it needs to be documented well so that we can include it into our plan of care, and we can provide a holistic management or treatment for our patients. Alright? So that's it, and thank you for listening.